Sorry, not. Yeah.
Oh,
Okay.
sorry.
No, you're good. Go ahead.
Okay. Our presentation's on HIPAA. HIPAA is the Health Insurance Portability and Accountability Act of 1996. It was introduced into Congress in hopes that people will, with healthcare reform. At first, it was known as the Kennedy-Kassebaum Bill. It was first passed in 1996 with two objectives in mind: to make sure individuals would be able to maintain their health insurance coverage when they change or lose their jobs, and to make sure that the patient's information is safe and secure. This would include certain regulations involving data transmission of any information that includes financial and administrative information. The Department of Health and Services oversees HIPAA and the regulation of sharing patients' protected health information. The main purposes of HIPAA are: it allows the patients to have more control over their own health information. It empowers individuals to be able to control certain ways the information is used and how it is disclosed. It gives the patients the right to see a copy of their own health information and request any corrections to be made of their records. It helps the patient to keep their insurance coverage if they change or lose their job, and includes provisions called administrative simplifications, a requirement that HHS adopt the national standards for electronic healthcare transactions, security, etc. It allows the patient individuals to file complaints, have them documented and made aware of their outcome. It limits the release of patients' information to a minimum and for the reason of the disclosure. Who must follow the laws and who isn't required to?
Hey, Andrea.
Yeah.
Sorry, it looks like Camille just hopped on.
Okay.
Sorry.
Hey, can you hear us?
I can. I'm sorry. I just hit a lot of traffic coming home.
Not a problem. So we started into your slides a little bit, but that's okay. If you just want to go ahead and take over, and we'll just go from there.
Okay, where are we at?
Can you see the screen? Oh, wait. If you look at the tiles down in the right-hand corner and click on Camille's, the other Camille's tile, it'll put a white box around it, and that will show you. It should show you.
Okay. So are we at the beginning part?
We're on the who must follow laws and who isn't required to slide.
Okay, so because certain people have to know what's going on. Sorry, I got to get my mind together. Health plans need to follow because they can't just openly give information out to people. Health providers also need to keep everything under wraps. They can't just arbitrarily tell people information about their clients, or the hospitals can't talk about the people that are in the patients, sorry. And then the clearinghouses, they need to keep it confidential unless they are given permission to let the information out. And then the next slide is who isn't required. So those who aren't required are life insurers, which I don't know if that's totally right, because my husband was just trying to get a life insurance policy and they requested his medical, he had to sign off to have his medical records sent to the insurance company. Employers, I guess they don't have to follow the laws. Workman's comp, they don't. Most schools, because they want to make sure that everybody has their shots and everybody won't pass on illnesses to anybody else. Law enforcement agencies don't need to follow it because they need to protect everybody, and it would take too much time to try and find out medical situations on people. We had a case here in San Diego where a mentally disabled person was shot by police, and it's all up in arms because why they shot a mentally disabled person, but they didn't have the time to find out when people's lives are in danger. Child Protective Services, they don't need to because, of course, they're trying to protect the children that there is in their realm of care. And then municipal offices, they don't need to follow it because they need to know what's going on around them and who is. They don't have to take the time to. I'm so sorry, you guys. I'm just so flustered. I've just totally gone blank. Anyways, municipal offices, they don't need to follow it because they need to be able to know who's around them and who's what the illness is or the situations are of the people around them. Can we go to the next one? The people that watch out over and enforce the standards of the HIPAA is the Office of the Civil Rights and the Office of the eHealth Standards and Services. That's obviously the electronic aspect of it. And then Centers of Medicare and Medicaid Services, they really have a lot of pull and stuff like that because it involves so many people that are on Medicare and Medicaid. The next slide.
All right, so this is mine. So the patient privacy under HIPAA, you can, this kind of already touched on, you can ask to get a copy of your personal medical records. You can ask to change anything you think is wrong. You can know how your health records are used, where they're being shared by your physician and insurance. And you can let your insurance companies know if there's information you don't want shared with anyone. So the HHS has published 4 rules that provide a standard for the professionals to follow. The 4 different ones, we have the privacy rule, security rule, enforcement rule, and the omnibus rule. So the privacy rule, it set national standards for the protection of individually identifiable health information. And it did this by 3 different covered entities that include health plans, healthcare clearinghouses, and healthcare providers who conduct the standard healthcare transactions electronically. The next one, security rule, sets national standards for protecting the confidentiality, integrity, and availability of electronic protected health information. The enforcement rule provides standards for the enforcement of all the administrative simplification rules. And the omnibus rule implements a number of provisions of the HITECH Act, which is up in the corner there. I have a little explanation of what that is. It just expanded the reach of HIPAA privacy rule and security rule. And that the HITECH Act strengthens the privacy and security protections for the health information established under HIPAA, which finalized the breach notification rule. And the breach notification rule just requires the entities and businesses to provide notification if there's a breach of the unsecured protected health information.
Okay, so my slides are on COBRA. So the Consolidated Omnibus Budget Reconciliation, I think I'm saying that right, Act, gives workers and their families who lose their health benefits the right to choose to continue group health benefits provided by their group health plan by their employer for limited periods of time under certain circumstances. The qualified individuals may be required to pay the entire premium for coverage up to 102% of the cost of the plan. So in other words, COBRA requires that group health plans sponsored by employees with 20 or more employees in the prior year offer employees and their families the opportunity for a temporary extension of health coverage. And this is called continuation coverage. And this is in certain instances where coverage under the plan would otherwise end. So next slide. So who can be covered by COBRA? COBRA generally applies to all group all group health plans maintained by the private sector employers with at least 20 employees or by state and local governments. The law does not apply, however, to plans sponsored by the federal government or by churches and certain church-related organizations. There are 3 basic requirements that must be met in order for you to be entitled to elect COBRA continuation coverage. And the first one is your group health plan must be covered by COBRA. So your employer must have at least 20 employees or more in order to be covered by it. Second, a qualifying event must occur. And a qualifying event is anytime there's a death of a covered employee, the termination or reduction of hours of a covered employee's employment, the divorce or legal separation of a covered employee from the employee's spouse, or a covered employee becomes entitled to Medicare due to certain acts. And then the last one is you must be a qualified beneficiary for that event. And so a qualified beneficiary is someone who is covered under the plan immediately prior to the qualifying event and who is either the spouse or dependent child of the covered employee or the covered employee. So COBRA continuation coverage is usually available for up to 18 months after it has begun, and it can kind of vary depending on the situation. It can get up to even 36 months depending. And then as I did a little bit of research on COBRA, I kind of learned that it's not always the cheapest route for people. So it's kind of always good to look into your other options before necessarily choosing this plan.
Okay, so portability. The portability of HIPAA is designed to improve the portability of the health coverage for those people that change jobs. So basically, when they change jobs, it can help them and cover them for a while. The portability includes the certificate of credible coverage, and it is issued when regular coverage is lost, COBRA coverage is lost, the COCC is requested by a member while still active, and within 2 years of losing coverage. Portability is an employee's right to keep or maintain certain benefits when switching employers or when leaving the workforce. The Health Plan Insurance Portability and Accountability Act, HIPAA, provides rights and protections for participants in group health plans since 1996, and currently it's always increasing its way to efficiently reduce costs by establishing standards. HIPAA also prohibits discrimination against employees and their dependents based on health factors that may have, including prior medical conditions and previous claims experience. HIPAA makes sure individual care plans are accessible and always improving new methods for how our medical data is shared in the health system across the United States. We can now share medical records from paper to electronically through a click of a button. Another interesting fact is that it preempts state laws unless the state regulations are more stringent. I think that's it.
And there's our citation.
Awesome. Great work, ladies. You covered the topic very well. There's a really important thing, the hospital we're focused on all the time because we want to make sure that patient information is. I'm sure you've noticed by now I asked each group the same question, and that is, what is the most interesting thing that you learned when you're studying? I'll start with Andrea now. Did you hear that, Andrea?
No, sorry. I didn't hear the name.
What was the most interesting thing that you learned when you were studying this topic?
I don't know. I thought the portability part was really interesting because I work in healthcare. I'm actually a CNA, so most of it I already knew, but I didn't know about the portability part. So it was interesting that they cover people after they're fired and stuff for a little while.
Right. And as you mentioned, it's super expensive, but it is covered. All right, Camille Coffee. 10 questions.
How much power we as patients have over our own records. I didn't realize we had so much access to them, and because doctors don't really make you think you can get into your records for any reason, or if they do, they give you a lot of problems trying to get into them. So to be able to stay on and keep track of your own records is kind of cool.
Yeah, that is a really cool thing to be able to have the power as a patient to get in and view your stuff. I know the last place I worked, and even the place I work now, there's apps available that you can pull up your medical record at any time and see the notes and everything. So yeah, that's really cool. I agree. All right, Camille.
So I thought it just was really interesting because I'm sort of working in the healthcare industry now, and I'm planning on becoming an RN eventually. And as a healthcare worker, you're held to such a high standard of non-disclosure. And it's nice to know that as a patient, other healthcare workers are also held to that standard with your own personal stuff. So it's like a two-way street. And it was just cool to see how important the patient privacy is.
Yeah, and it's actually really cool. I mean, sometimes people might think we're taking it too far, but I think it's really cool. I mean, make sure that, I've never been to the hospital for a reason that I don't want anybody to know about, but sometimes there are people that don't want people to be looking into different things in our records and stuff. So, we'll see how far they go to privacy of the patient. All right, Caitlin.
Okay, so I just kind of thought it was all really interesting. I mean, I'd learned about HIPAA before, but there was still a lot that I hadn't known about it. But I thought, obviously, because I did a lot of research on the COBRA health insurance, I thought that was interesting. I'd never heard of that before. But I think it's cool that, even if someone does have an unfortunate event happen to them, that they can still be covered or have the option to be covered with health insurance while they're trying to figure out other things in their life. I just found that to be really cool.
Great. All right, so I'm going to go ahead and stop the recording.